Hello, good afternoon. My name is Dr. Chudi Ufundu of Aspirations Global Health Solutions. Thank you and welcome to our weekend open clinic. This afternoon, we're going to talk about the appropriate time to start appointment with your doctor when you have checked and you noticed you're pregnant. When is the right time to touch base with your doctor? What do you need to do next? This is very important for so many reasons. So if you're currently pregnant and all you've done is to go for the urine pregnancy test, if you have not gone for your blood test, if you have not gone for your ultrasound test, and you're wondering when you should start, this clinic will help you a lot. This particular clinic will help to put a lot of things into perspective. So please, when you join today's clinic, I need to know who you are. So do me a favor, let's know your name and your location. Then as soon as we have a good number, we're going to start. It's important to understand that pregnancy follows a particular process. So there are certain things that must happen at certain times. There are certain tests we need to run to confirm your status. When you check for pregnancy with urine and you're pregnant, that's not the last. That's actually the beginning. You actually have to run 2 more tests, which will now confirm you're pregnant before you go to the next stage. So we received a couple of questions from our members. And one of the questions said, I'm pregnant. How soon do I need to see a doctor? Then one said, you just found out she's pregnant. How soon should I see a doctor? Also, does the doctor I see right away have to do the same one that will help me throughout the pregnancy? And when to see a doctor after pregnancy test? So these are important questions that so many women might currently have regarding their current pregnancy status. So what's the right thing to do? So that's what I'm going to take you guys on, and I'm going to actually start. Now, the right thing to do, first of all, is to congratulate you for becoming pregnant. Lately, becoming pregnant seems to be very difficult for some people. So if you succeed in becoming pregnant, congratulations. Now, the most common time to have your appointment, it's around the neighborhood of 8 weeks or just about a month after the first missed period. This is the ideal time to book an appointment and see a doctor. Just about 8 weeks. So if you currently noticed you've not seen your period and you've checked and the urine pregnancy test is showing you positive test, most times we want you to establish with your doctor about the 8 weeks gestation or just about a month after your first missed period. It's important to understand that some missed periods might actually not mean pregnancy. There are some women that will miss their period, but they are not pregnant. So we need to understand the likely things that might cause a woman to miss her period and she's not pregnant. Now, ideally, you should contact your doctor within the first few days after taking your pregnancy test. That's ideally. But most times we don't follow things ideally. We customize things. It's best to schedule an appointment with your medical provider to confirm your test. So when you run your urine test, you run your blood test, it's important to run your ultrasound test. Ultrasound is the test that will confirm that you're clinically pregnant. If your ultrasound test is missing, we have not confirmed you're pregnant. So it's best to meet with your provider so we can run our ultrasound test and look out for the gestational sac. When we are running an ultrasound, we are checking the inside of your womb for the gestational sac. So it's a very important test you have to run, and you can only run this test with your doctor, your ANC doctor. Now, some women might need to see the doctors sooner. So if you notice any of the symptoms I'm going to mention in your current pregnancy, please book an appointment and see your doctor immediately. If you notice severe abdominal and vaginal pain, if you notice unusual or unexpected bleeding, if you notice sudden swelling of your hands, your feet, and your face. If you notice you are persistently vomiting relentlessly, no matter what you do, you vomit. If you notice excessive headache, if you have a chronic medical condition like diabetes, hypertension, or autoimmune disease, if you have fever, or if you notice persistent itching in your body, you need to establish with your doctor immediately. Pregnancy changes the whole body. Right from the very first time you notice your pregnancy, pregnancy will change your whole life, your whole body, everything about you will change. Now, besides the broad range of emotions which you will experience during your pregnancy, it's important to pay attention to the changes and the symptoms, which if it's excessive, then you need to begin to seek for help. Now, many people that are pregnant will need to see the doctors early. For instance, if you have diabetes, if you have high blood pressure, if you have a history of ectopic pregnancy, or if you're on medications for chronic medical problems, like if you're asthmatic, if you're diabetic, if you're hypertensive, if you have other drugs you're taking for other medical problems, you need to see your doctor immediately. If you are bleeding or if you have pain, just like I mentioned earlier, you need to establish with the doctor immediately. You also need to understand that within the month you just became pregnant, there are so many changes in your life that will challenge you mentally, psychologically, socially, physically. There are so many changes that will happen in your body because pregnancy changes everything. So it's always nice, if possible, to use the same doctor. So first of all, when you're checking with a doctor, it's important you know the type of doctor you're checking with. So a gynecologist who is qualified, it's always good to use the same doctor throughout so that he will monitor and see what you will come up with. Now, you also have the freedom to change because there are certain things that will change which you can't help. For example, if you need to switch your provider because of distance, because you suddenly moved on your location, definitely you need to do that. Thankfully, we can exchange data so we can get your report from the previous place you recently started going. So if you need to change, change. However, in some places, if you change to a new place, you might have a need for doing everything all over again, but it's okay. Now, your first visit after pregnancy, when we confirm that you're pregnant by running the ultrasound and seeing the gestational sac, your first visit as a pregnant woman is called booking. Now, during this booking, there are so many things we need to know, so many. Starting from your medical records, we need to update your medical records. We need to conduct a physical examination. We need to update your pap smear. If you haven't done your pap smear test, we need to make sure we do that. We need to make sure we get your blood work. We need to make sure we counsel you on genetic testing options. And we need to check the pregnancy itself. So whether you've done an ultrasound previously or you haven't done, it's important we date that pregnancy. The pregnancy is dated by checking in weeks. So every woman needs to know her gestational age, which is GA. So pregnancy is dated in weeks, not in months. So you need to do all this and follow through and make sure that everything is properly taken care of. Now, what do you expect at the doctors after pregnancy test? Now, when you're contacting your doctor, you need to answer a lot of personal questions. When did you miss your period? When was your last menstrual period? What about your symptoms? So we ask you a lot of questions. Then afterwards, once the pregnancy is going okay, we're going to give you an appointment. Now, your prenatal visit will start about that 8 weeks of suspected pregnancy. So always about 1 month after you've tested positive. Now, you need to do all these. Your appointment needs to be verified. Your test results and everything need to be in synchrony with whoever is managing you. If we can do this, then we will better understand what our duty is. Now, thankfully, most of the pregnancy tests we run lately is accurate. So the accuracy of your urine pregnancy test is actually about 98%. But when you check urine pregnancy test and blood test is always superior. Now, still some mistakes can happen. Some people might not do it appropriately. So you can have a false positive or you can have a false negative outcome. This is why you need to see your doctor after taking your at-home pregnancy test so we can do it better and confirm your pregnancy. So we have to evaluate your situation on individual basis. Once we confirm that you're pregnant, then we've done our best, then we keep giving you appointments. Remember, if you're 35 years and above, your pregnancy is classified as advanced in maternal age. So we have to give you frequent appointments. The appointment we'll give a lady that is in her 40s is not going to be the appointment we'll give a lady that is in her 20s. The older you get, the more appointment we'll give you. So we'll keep an eye on your pregnancy. Okay, so that's my presentation. It looks like no one attended. It looks like I just have maybe one person that came in, then left. But that's okay. If today is the first day of attending my clinic, thank you so much. I look forward to seeing you guys again on Tuesday. Until I see you, enjoy the rest of your weekend, and bye-bye for now.